How often people with bipolar disorder receive electric shock therapy against their will? Facts, fears, and reality. Ladies and gentlemen, today I want to talk about one of the most misunderstood and emotionally charged subjects in all of mental health, electroconvulsive therapy, or ECT, and the question many people quietly wonder but rarely ask out loud. Do people with bipolar disorder get shocked against their will? To answer this honestly, we need to separate myth from reality, fear from fact, and history from the modern world of medicine. Part 1. The Shadow of History. If you ask the average person what ECT is, many imagine scenes from old movies, dramatic convulsions, people strapped down, electricity as punishment, and no anesthesia. Those images are powerful, but they come from the 1940s and 1950s before modern medical standards existed. Back then, yes, ECT could be used in ways that would be unacceptable today. But let me make this absolutely clear. Modern ECT is not performed that way. Today it is done under full anesthesia, muscle relaxants, monitoring, medical supervision, and the safety standards are extremely strict. Part 2. How often is ECT used today? ECT today is actually rare. Most people with bipolar disorder never receive it. Most psychiatrists never even recommend it unless medications have failed, the person is dangerously depressed, the person is catatonic, or the person is suicidal and rapidly deteriorating. In the United States, fewer than 0.5% of psychiatric patients receive ECT in a given year, and the vast majority of those treatments are voluntary. So let's be clear, ECT is not a routine treatment for bipolar disorder, and it is not something doctors casually use. Part 3. What about against their will? This is the part that scares people the most. So here are the facts. Involuntary ECT can only happen under very strict legal conditions. It typically requires a judge's approval, proof of life-threatening danger, and usually several failed treatments. In many states and countries, a judge must sign off that the patient must have a lawyer, and the hospital must show that nothing else works and the patient will likely die or suffer irreversible harm without it. So how often does involuntary ECT actually occur? Extremely rarely. It is one of the least commonly used involuntary procedures in psychiatry. The law treats it much more carefully than involuntary medication or involuntary hospitalization. Why does it ever happen? When it is used involuntarily, it is almost always because the situation is dire. These are cases where the person is so severely depressed or suicidal that they cannot eat, drink, or function, or someone is catatonic and risks organ damage or death, or someone suffers a psychotic depression that is rapidly worsening and medications have failed. In other words, involuntary ECT is considered only when doing nothing would mean losing a life. Hospitals and courts do not use it because someone is difficult or acting out or non-compliant. They use it because the person is too sick to consent, and the illness itself prevents them from understanding they're dying. This is rare, but it does happen because mental illness can become that severe. Part 5. Why does ECT still exist? Even with stigma, fear, and controversy, ECT remains in the medical toolbox for one reason. It works extremely fast when nothing else does. For some people with bipolar depression, medications may take weeks. Therapy may not help, but ECT can lift a life-threatening depression within days. When someone is refusing food or water, hallucinating to the point of danger, or unable to move because of catatonia, speed matters. And for that reason, ECT is still allowed, but under extremely controlled conditions. Part 6. The Emotional Reality. Whether voluntary or involuntary, ECT carries a heavy emotional weight. People fear losing control, losing memory, being forced, being hurt, being misunderstood. Family members feel guilt, helplessness, and confusion. This is why transparency matters. This is why consent matters. This is why strict legal protections exist. No one should ever be surprised by ECT, tricked into it, or rushed into it. The process must be slow, careful, documented, and supervised by the courts. Part 7. The truth people need to hear. So here is the truth. ECT is rare. Involuntary ECT is even rarer. Most bipolar patients never come near it. When it is used, it is almost always to save a life. Modern ECT is nothing like the old Hollywood version. The idea that bipolar patients are being shocked against their will on a large scale simply is not true in modern psychiatry. But the fear is real, the stigma is real, the history is real, and people deserve to understand the facts clearly without exaggeration or denial. Conclusion. So when people ask how often do bipolar people get ECT against their will, the answer is almost never. Only in the most extreme emergencies and only under strict legal protections. What we should talk about instead of fear is better access to treatment, better medication options, better crisis care, and reducing the stigma that keeps people silent until they're in danger. Understanding the truth helps us reduce fear, show compassion, and replace myths with clarity. Thank you.